I'm Marianne Matthews, Chief Editor of Axis, reporting from HIMSS. I'm at the Carestream booth and I'm talking with Cristine Kao about some of today's healthcare IT challenges. Cristine, what are you hearing from healthcare IT leaders about their pain points when it comes to the storage and management of data and images?
Yeah, well, that there's a lot of it to start. You know, there's just a massive amount of data that we're generating today. Not just only from traditional modality devices like CTs, MRs, but even also bedside monitoring, wearable devices from patients, Internet of all things, if you will. So we're getting all sorts of data sources now, and a lot of the leaders are coming in this week asking us, help us understand, a long-term strategy to be able to archive it, manage it, and make sense of all of it all. Okay? And that requires a lot of different strategies in place in order for them to do that.
Interesting.
Yeah.
I'm also hearing a good deal about interoperability,
Oh yes.
and
Yeah.
that it's still quite the challenge.
Yeah.
What have you heard about the ANC initiative and the Office of the National Coordinator initiative and the interoperability guidelines?
You know that you're right on with that. So it's so much of a challenge that the government has to set up a new set of guidelines. What's really promising from the ONC guidelines in terms of interoperability is that it's taking a lot of already existing standard sets of protocols that are out there and making it much more widespread. And I know also HIMSS has already supported that. The biggest, I think, encouraging from an imaging vendor perspective is that from an image perspective, DICOM will continue to be a standard for protocol, and but a lot of the new things that we've been working on, such as IHE protocol for cross-document sharing, or web type of protocols like WADO, the things that we've already been working on is now being recognized as the guideline moving forward. So I think it's good news for a lot of us, in terms of now really having a blueprint moving forward as to how to manage and interact and exchange of information.
Wonderful. And
Yeah.
as you say, I mean, radiology has been doing this sort of thing, so
Exactly.
it's an
Yeah.
opportunity.
Absolutely. Radiology could really, it's an opportunity, I think, for us, and I say us as a radiology industry in general, both providers, specialists, and ourselves, really take on the leadership role and really encourage that type of conversation moving forward, because, radiology has done it.
Exactly.
We've digitized for a very long time. We know the workflow. We know how to do the exchange. And, how do we elevate that to the enterprise? I think we're in a perfect position to do so.
I agree.
Yeah.
Thank you very much.
Well, thank you, Marianne.
Marianne Matthews reporting from HIMSS.
Thank you.